When comparing blueberries and cherries for inflammation, both fruits offer serious benefits, but their strengths come from different mechanisms, and choosing the better one may depend on your specific needs, such as muscle recovery, joint health, or chronic inflammation control. Blueberries have long been regarded as one of the most potent anti-inflammatory fruits, largely due to their high levels of anthocyanins, flavonoids, and other polyphenol. These compounds have been shown to reduce markers of oxidative stress, lower C-reactive protein, CRP, and support vascular health by enhancing endothelial function. Regular blueberry consumption has been linked to improvements in insulin sensitivity, brain inflammation control, and reduced risk of heart disease. Their anti-inflammatory effect is systemic and gradual, making them a reliable long-term ally for managing chronic inflammation and preventing age-related degenerative diseases. Cherries, especially tart cherries like Montmorency, bring a different and, in some cases, more targeted anti-inflammatory effect. Tart cherries contain high levels of anthocyanins like blueberries, but also unique phytochemicals such as melatonin and quercetin. Studies show that tart cherry juice can significantly reduce post-exercise muscle soreness, joint pain in arthritis sufferers, and markers like uric acid, which is a key player in gout. For acute inflammation and physical recovery, cherries have a distinct advantage over blueberries. They don't just prevent inflammation, they actively reduce it after damage has occurred. However, there are warnings to consider with cherries, especially sweet varieties. While sweet cherries also have antioxidant benefits, they're higher in sugar and lower in total anthocyanin concentration than tart cherries. Consuming large amounts of sweet cherries, especially in dried or juice form, can lead to a rapid spike in blood sugar. Tart cherry juice, while effective, is often sold in concentrated form and can contain added sugars unless labeled otherwise. Look for unsweetened, 100% tart cherry juice or freeze-dried powder to avoid these pitfalls. Another point, blueberries offer more fiber and fewer natural sugars per gram than most cherry products. This makes blueberries a better option for people managing blood sugar issues, metabolic syndrome, or insulin resistance. They also tend to be more shelf-stable, especially frozen blueberries, and easier to incorporate daily without added sugars or flavor masking. To get the best of both, use them strategically. Blueberries are ideal for long-term inflammation management, especially for those dealing with cardiovascular issues, early cognitive decline, or metabolic disorders. Tart cherries, on the other hand, are best used in targeted scenarios like post-workout recovery, flare-ups of joint inflammation, or improving sleep quality due to their natural melatonin content. If you're replacing blueberries with cherries due to availability or recall concerns, consider mixing tart cherry powder or juice with fiber-rich ingredients like chia seeds, oats, or almond butter to slow sugar absorption. Rotate with other low-glycemic fruits to avoid over-reliance on cherry-based products, especially if blood sugar is a concern. In conclusion, blueberries and tart cherries both deliver powerful anti-inflammatory benefits, but they work best in different situations. Blueberries are your foundation, safe, stable, and supportive over time. Tart cherries are your rapid response option, ideal for muscle recovery, sleep, and acute inflammation. Neither one is strictly better, but together they make a potent anti-inflammatory duo. Use wisely, source cleanly, and diversify often.